everyone. Good morning, and thank you all for being here. Today I'm pleased to introduce new legislation that would put the health and well-being of Albertans first when it comes to auto insurance. The Automobile Insurance Act proposes key changes to make auto insurance in Alberta more affordable and stable. Even more important, the legislation puts a Care First auto insurance system into place so Albertans who are injured in an accident can better access the supports they need to recover. In fact, if this legislation is passed, Alberta will be the first province in Canada to adopt a privately delivered Care First auto insurance system. It's a made in Alberta solution to best support people and families. The new legislation would provide innovative solutions to meet the challenge of reducing costs while providing improved access to benefits. Under a Care First insurance system, everyone injured in a traffic accident can access medical, rehabilitation, income support, and permanent impairment benefits. That's regardless of who is at fault in that collision, because everyone deserves access to care and treatment. But let me stress, fault still matters. The system will still ensure that bad drivers are held accountable through higher premiums, and Albertans would still be able to sue an at-fault driver in certain circumstances. But we have to make sure that such circumstances are reasonable, since lawsuits are driving cost increases in auto insurance, with reports showing a 48% increase in collision-related lawsuits between 2018 and 2022, and litigation costs exceeding $1.2 billion a year. It's no wonder insurance rates have spiked. This legislation will reduce costs while putting the focus on providing care for those who are injured in an accident. Care First is more than just a policy we want to implement through this legislation. It's a change that focuses on the care of injured Albertans first while keeping insurance premiums at a more reasonable level for Albertans. That's what this proposed legislation would support. Thank you.
Next up to the mic will be Dr. Jacqueline Boyd, Chair of the Chiropractic Association of Alberta.
Good morning. On behalf of the Chiropractic Association of Alberta, I want to express our strong support of the Automobile Insurance Care First Benefits Act. This proposed legislation marks a significant step towards ensuring Albertans receive timely, high-quality care when they need it the most, following a motor vehicle collision. As chiropractors, we are on the front lines of musculoskeletal care, helping Albertans recover from injuries and regain their quality of life. We see firsthand the physical, emotional, and financial toll being involved in a motor vehicle collision can have on an individual and their families. Ensuring that care comes first without unnecessary delays or legal obstacles is a meaningful and much-needed shift in our system. These changes matter, as Alberta's new Care First model prioritizes medical care and rehabilitation over litigation, helping patients recover sooner. With more accessible healthcare benefits, including chiropractic and rehabilitation services, Albertans will have the right support to return to work and daily life sooner. The system can also ease burdens on our healthcare system by streamlining access to effective, conservative care options, including chiropractic treatments for musculoskeletal injuries. We all know that musculoskeletal injuries, including back pain and whiplash, are the most common injuries following a motor vehicle collision. And as chiropractors, we are well positioned to provide evidence-based care that reduces pain, restores mobility, and improves long-term patient outcomes. By integrating chiropractic care into the new automobile insurance framework, we can help reduce costs, improve recovery times, and support Albertans' overall well-being. We commend the Alberta government for taking this important step to ensure faster and better access to care for Albertans. We look forward to continued collaboration as this system is developed to ensure the best possible outcome for patients. Thank you.
All right, we're going to move to the media Q&A. We're going to start in the room. One question, one follow-up. As always, please state your name and your outlet, and go ahead.
Hi, Cindy Tran with the Edmonton Journal. So I understand that someone can sue if the at-fault driver causes bodily injury and was convicted of an offense under the Criminal Code or the Traffic Safety Act. I understand a more detailed list is supposed to come, but could you provide examples of what that might be, like drunk driving, like running a red light, that kind of thing?
Yeah, we're going to have to continue to work through this process as we get to the real specifics, but the examples we've been using are exactly those. DUIs, distracted driving. It will have to be a fairly tight window. The more tort access that is allowed, you'll see the amount of savings, potential savings decrease. But we're looking at best practices. But it will be the most tort access or court access of any Care First system in the country.
Follow up, Cindy?
Yes, so with the tribunal being established, what would the process be like for someone who wants to appeal the decision that was made by their insurer to that tribunal, and how soon after would a decision be made?
I think we'll have to wait to get into those specifics, but we know that this works in other provinces. We know that there's the tribunal, other dispute resolution, entities that are set up. The exact timelines, we're working to get some more specifics for you, but we don't have that yet.
Go ahead, Catherine.
Catherine Krakowski, Alberta Today. So you're looking at potentially denying some types of care in certain cases for perpetrators. So what would be an example of a violation that would mean they don't have access to care? What type of care would they not have access to?
Yeah, those things are still being discussed, and they're looking at, best practices as well. I did hear that was brought up in the tech briefing this morning with the team. But things like the permanent impairment benefit, you have to look at, first off, you want everyone to get care regardless, or we see how that cascades through our social system. But there will be exemptions for those that egregiously caused an accident.
And another aspect of affordability and availability of insurance is the impact of climate change. And I'm wondering, in this 2 years, as you're looking to roll out the system, is that another aspect you're looking at in areas where there's frequent flooding or there's fires? That has an impact on the cost of auto insurance. Well,
if you have a hailstorm that rolls through the Calgary airport, I think someone on my team said it's probably the most expensive airport parking lot you could have hit in the world outside of Dubai. Those things, it comes down to, claims versus premiums. So a lot of that's very mechanical. But that's one of the things that's putting stress on the system. I think that's why it's important when you look at, what levers a government has, they're very few. This is the obvious one, and we can see how it's working out in other jurisdictions that's gone down this path.
Next question. Go ahead, Emmanuel.
Emmanuel Brestovet, Radio Canada. You really don't want to call this a no-fault insurance. Like, you call it a Care First insurance, but it has every parts of a no-fault insurance. So is it a no-fault insurance system?
Well, I think no fault's kind of a misleading term to begin with. I think you could say that's provides a lot of misinformation and connotation to the systems as they exist now. This is a fault, but it's a care-based system. I'd say it's moving away from a tort-based system. But yeah, I guess that's the way it's known. But as I've said, faults still will matter.
You have a follow-up?
And the press release, or maybe the briefing sheet, says that it's going to be the most generous system in the entirety of Canada. How can it be the most generous system while still saving Alberta's money?
Well, that's a good question about the system we currently have. I think I would spin you back on. But I would say what we learned through the consultation, they didn't want us to start from scratch. They didn't want us to build an entirely different benefits framework. So we chose Manitoba, which is known as, the highest level of benefits in the land, but something different because we thought it was defensible that salaries and wages are higher in Alberta on average. The one change that we specifically made was on income support. In Manitoba, it's up to $115,000. We made the change to $120,000 in Alberta. So I think that's where you're getting that claim. We took the highest level benefits in the land and we increased the income support.
Great. Michelle?
Again,
a fellow conservative province of Saskatchewan has a government-run insurance, auto insurance regime. So again, why does Alberta not want to do that? Like, why is this particular kind of system?
Well, I'd say a couple things. I'd say that, look at these in phases. I'm not saying that a future Alberta government won't, but I can tell you that the report shows that it would cost us $3 billion at least to operationalize and capitalize. My team thinks it would take 5 years. So I think it's prudent that the main cost savings is in the, the products delivered and changing the system. We have 4,000 to 5,000 Albertans that work in the private delivery side of insurance now. We think that it can provide, competition and rate increases and options to Albertans. So we think this is the prudent path. You saw the budget. We're not even in the new fiscal year yet. No path to balance. That's certainly something that I don't want to undertake right now for many reasons. But I'd say we believe in competition. We believe in private market. But we think this is the first step.
Is it fair to say that you're going to keep an eye on this and see if rates do come down, and if they don't, maybe these insurance companies will be kind of on?
Well, I think the insurance companies will have to work with us. We've been clear about the savings that we think that this will provide. They are under a lot of pressure right now from the hailstorm question and the like, and rising costs, tariff concerns. There's a lot of increasing costs on that side that a government like ours can't really influence. But I think the insurance companies will see that if they're unable, there is many public insurers across the country.
Go ahead, Lisa.
Lisa Johnson, Canadian Press. I'm sorry this is off topic, but I'm dying to get your thoughts on something. On March 8th, the Premier was speaking with an American news outlet called Breitbart, and she said that she had been speaking with people in the Trump administration saying, hey guys, can you pause these tariffs? Because this whole tariff issue is hurting our guy, Pierre Poilievre, and the Liberals going up in the polls. She's been criticized as asking a foreign government to essentially interfere in our election. I mean, what do you make of those comments from the Premier?
Well, I haven't seen the interview. I'd start there, but I would say I think the tariffs should be paused indefinitely for other reasons. That's where I would start. No secret, the Premier's been working hard to make sure that the U.S. administration at all levels understands the impact this will have to not only Canadians and Albertans but Americans. And I think that's wise. She's trying to approach diplomacy like a diplomat. I like that. As far as any conversation about our federal election, I couldn't comment. I would say we had a provincial territorial meeting with finance ministers on Friday, and I was heartened to hear a lot of the things that we've been pushing for about, growing the economy in this country is being listened to and agreed to now. We had actual consensus that Bill C-69 needed to be killed around the finance minister's table. That's a new development. So, regardless of who wins the federal election, I hope this country moves to a place where, we're acknowledging our strengths as a resource-based country, and we're trying to ensure that Canada, exists and can grow wages, for a long time. So I'm heartened by some of those changes.
Follow up.
Yeah, I guess some of the concern that people have is it appropriate for the Premier to be tying the issue of tariffs to the election and how it's affecting polls in favor, it seems to be affecting polling in favor of the Liberals. So if you take an opposite hypothetical here, if the Premier were to go to the Trump administration and say, hey guys, you need to jack up these tariffs, you need to put these tariffs in place against Canada because it will help Mr. Poilievre in the election. If she were to do that, would you consider that asking a foreign government to interfere in our elections?
Well, I don't think we should ask foreign governments to interfere in our elections. I think there's nobody in this country, regardless of political persuasion, that believes that tariffs are a good thing. It seems like both parties at the federal level are very much aligned in that way. So I can't comment as to what the Premier said or didn't say. I didn't hear the interview, but I think that should be the focus.
Go ahead.
Heba Kamal Shafiul, City News. Just back to the new auto insurance system. So Alberta has one of the most expensive premiums, or second exactly, in Canada. So with this new one implemented, if passed, can you like maybe talk a little bit more about affordability in terms of like comparing Alberta to other provinces?
Yeah, well, you're correct. We're the second highest currently, just behind Ontario. Ontario, I know, is watching this legislation closely, I would say. The Oliver Wyman report, it showed, I forget the exact number, but between $375 and $385 dollars of savings, I believe. And that's, a snapshot in time. The system's changing, the pressure's increasing. But I guess what I would say is that, you're basically taking 20% of the cost out of the system. And that's going to be, given back to the system through increased benefits and access to healthcare and savings. Some combination of where exactly that lands, we'll have to see. But we're confident that with what we see in other jurisdictions all around us, that the savings will be there. I guess Albertans need to understand that everything is getting more expensive while we build this too. But we're confident in the base case that this will provide savings.
Can you maybe just give an example of one or two factors that will contribute to lowering the cost by switching to this new system?
Yeah, well, I guess if you believe that people are getting the benefits, say you believe people are getting an appropriate level of benefits right now, if they sue, if they have someone they can sue. If you don't have an at-fault driver to sue, very challenging, obviously. But you do have to take out the cost of, disbursements to the lawyers, 30 to 40%. But the thing that's also very important is the time. If you're going to have to go through that process, it may take a year or two. This is going to ensure that people get the care that they need and can, return to work, but return to their life in whatever capacity they're able. Not everyone will be able to fully recover, but get back in their life and have it at the fullest, most utilized level possible.
Great. We'll go to the phones. Operator, can you put through our first caller?
Our first question is from Kevin Green from CTV News Calgary. Please go ahead.
Just for the minister, several times this morning you have said details are still to come, details have yet to be worked out. It seems like what you're saying is that this whole legislation hasn't been fully fleshed out. I'm just wondering what the rush is to bring it forward if the details haven't fully been fleshed out. And as you flesh out those details over the next coming years, how can you promise Albertans that the interests of Albertans rather than the interests of insurance companies will hold a priority?
Well, a couple things. I wouldn't characterize it that way. I would look more at the amount of work that needs to be done before January 1st, 2027. This is an extremely heavy lift. This is a substantial change, and this is the first start of the process. I would describe this legislation as enabling. A lot of work needs to be done on the regs behind it, but that's the way this process works. You stand up the enabling legislation first, you continue to consult and get into the details, and a lot of that we will rely on what's been done in other provinces with our specific Alberta tweaks. What was the second question? Sorry.
Well, I guess it follows from that as this the common idiom, the devil's in the details, and you said the details have yet to be worked out over the next 2 years. How do you ensure that as those regulations are worked out, that the best interests of Albertans are held up and ahead of the best interests of the private insurance companies that seek to save money?
Well, we wouldn't be doing this otherwise. I can assure you that not on both sides of the equation, people are, I'd say, people in this system are, they're committed to seeing it through. But I'd say there's concern from the insurance companies, say that we'll go too far on the court access. you know, they want to know that it's a product that they can deliver. I think we have a healthy tension on all sides, and I think that shows the commitment of this government that we're only doing this focused on Albertans. I don't think a government would attempt this in a 4-year election cycle if they weren't committed to the Albertans, and that's always been our goal, and it always will be.
You have a follow-up, Kevin?
Well, that's it. Thank you.
Great. Operator, are there any other callers?
There are no other questions at this time. Please proceed.
Great. Anyone who didn't go question and want to ask one? Thanks, guys.
Thank you all very much.